Hello. It is 1 month post-op for me, so I thought I'd make an update video about how things have been going since I made the last one, which was just, I still had like the bulky binder on. It wasn't even a week post-op. So, yeah, the last couple weeks, the first month was definitely hard. I'm really feeling I'm just starting to feel like I'm getting my full mobility back. Like, I'm only starting to feel comfortable driving in the past couple of days because especially like I just didn't feel like I could react quickly enough because it took like more quick movement than I felt I was capable of because I wanted to like be delicate with my hey look a friend hi hey buddy I wanted to be more delicate with my like stretching my incisions and stuff so I am driving now and I'm able to lift up to 20 pounds, and I'll be able to lift anything on March 2nd, I believe, which is in another couple weeks. What's wrong with you? I know you want to play. Listen, pal. I'm trying to make an informative and helpful video. And you just are making it all about you. I'm going to play with my cat while I talk. Is that okay? No, I think I'll just take another video. Okay, I think that he has had enough for the time being. No, stop. Those are my... You're such a bad boy. He was chewing on my scar strips. 1 minute more, please. Okay. One last try here. So let's see. Yeah, it definitely, the first few weeks were hard because I felt very limited in my range of what I could do. I couldn't clean. I couldn't, like, I had to ask for help for, like, getting things off high shelves. I still do, but, like, I just felt like I had to ask for so much help to do everything, like, clean my room and do my laundry. And that was, like, psychologically hard. Oh yeah, and I started going back to school. I started going back to school this after about a week and a half, and that was hard because it was just really, really tiring to go to class. Like, I would go to 1 hour of class, then come home and sleep the rest of the day. Yeah, just a lot of resting. I couldn't do as much as I could before surgery, and I like knew that was going to happen, and yet actually dealing with it and doing less was really hard for me. And I still am going to have to do that in the next month or two, especially. But I'm definitely feeling more capable, like driving, cleaning, things that like make me feel better. Like it was hard because I was feeling depressed from just lying around all the time, and yet I couldn't do the things that usually make me feel better. Like I couldn't take baths because I can't take baths until 6 weeks after surgery. I could barely clean my room. Like I needed help lifting heavy things or like making my bed. I had to like stretch my arms out too much. It was hard to like go out for like walks or to a cafe or stuff because I was just so tired, and I couldn't like walk very far, and I couldn't drive, so I had to get driven everywhere. So all those things just like led to a lot of low emotions, but my partners were very supportive and reassured me a lot that it was okay that I was asking for their help and all these things. And then another thing that was happening, and still sort of happening, is that like this part of my chest feels very sensitive, like a bad sunburn, sort of like really raw, and that made wearing like t-shirts hard because like whenever anything rubbed against this area, it would feel really bad. So I contacted my surgeon because I hadn't really heard anybody else talking about that kind of pain. Excuse me. This is very rude. Thank you. But he said that that's normal, and it's just like that the nerves are, he said it's pain from the nerves being irritated, and that it can be anywhere from mild to debilitating, and that my case seems to be mild, because it's like a 1 to a 3 on the pain scale. and there is a med that can help if I felt like it, but it also makes you drowsy. So I decided to pass because I have been doing enough lying in bed and sleeping, and it is sort of mild. And he says that it'll pass in a couple weeks. So like as long as I know that it's normal and it will go away, that made me feel better. So that's something that can happen. Yeah, because it was very like surface level skin, feeling very raw and delicate, which is something I haven't heard a lot of people talk about. And I started scar strips a little over a week ago, and that seems to be going well. I have a little bit of a scab left just on this nipple, and I'm waiting for it to fall off before I start doing strips over my nipples too. But I'm really happy with how my nipples turned out. I'm really glad that the scabs are finally gone because it was so hard to not like pick at them, which I mostly managed to not do. So like when they were like flaking up, I was like, just took that part off. So yeah, scar care is going well. My scars look good, and I have a little bit of like a outie thing right here. I don't know if it'll go away or not, but I'm not really bothered by it. Oh, and it just feels so good. Like, so that's all the bad stuff. But like on the other hand, it feels so good to have gotten top surgery. Like, I feel so much better. Like, this just feels right. Like, I don't even remember what it's like to have boobs anymore. Like, it's been 3 weeks or 4 weeks, and I'm just like, this is how it should have been. And like all my t-shirts feel like brand new. It feels so good to put shirts on in the morning. It's like a candy drawer where I'm just like, what do I want to wear today? Like everything feels new, and it's really exciting. And yeah, I'm just really happy and looking forward to continuing the healing process slowly but surely. Yeah, so if you have any questions about things that I haven't talked about that you want to know about, just let me know and I will reply. And thank you for watching.